that allows them to have a turnaround time of 24 hours. And they can get that result back to our healthcare providers in a relatively short time. Some of the commercial labs are receiving thousands, tens of thousands of these from healthcare providers from across the country. And the amount of platforms that they have to process these is unknown. And their response times are now getting into 5 days, 6 days, 7 days. And some of our healthcare systems are using those commercial laboratories. And that's why you hear patients' experiences with some of the testing sites or some of the healthcare systems. If their test, this tube, is being sent to one of those commercial labs, their wait for their result may be prolonged. What we now know is many of our hospitals are using a laboratory in their hospital. They just send this tube downstairs to their laboratory, and their laboratory is processing that result very quickly on their campus for that first priority group that I described. So the healthcare workers, the inpatients in that hospital, they're processing that on campus. And we want them to do that. We want them to prioritize that group. And this is why that's critically important. We want to make sure our healthcare workers are kept safe, that if they are infected or impacted by COVID-19, we get them the resources that they need, that they self-quarantine so that they don't infect other healthcare workers and patients, and that we can get them back to work to be on the front lines of this pandemic. The other thing is if that there is a patient in the hospital who is being tested, the sooner we know whether or not they have COVID-19 as the reason for their symptoms and the reason for their hospitalization, the faster that hospitals can make decisions about how they're using those inpatient or hospital resources. So some of the hospital resources that are used while they're waiting for a test include that precious personal protective equipment that we've been talking about. Those surgical masks, those N95 respirators, the gloves, the gowns, the face shields, all of that equipment has to be used. The rooms, the negative pressure rooms, the high airflow rooms, all of those things are used until you know the patient's status, and once you know the patient's status if they're positive. And again, some of the hospitals have made decisions in terms of how they use their clinical personnel, which personnel are caring for patients on a designated respiratory ward. So all of these things help us to make decisions about where we build laboratory capacity at the public health lab, how our health system providers are making decisions about what to process in-house, how to partner with the city to use the public health lab more efficiently, and which tests can go out to commercial laboratories. I also want to underscore that we are making decisions about who to test if it's going to change the clinical management or the public health management of that individual. Okay? So if you're going to have to self-quarantine or self-isolate while you're waiting for your test result, we recognize that it may be a high period of anxiety for you to wait a difference from 24 hours or 7 hours. But if you have mild symptoms and you're going to remain at your home, we are asking for your patience during that period of time. It's very important for us to get timely results for those patients who are in the hospital, who may be critically ill, and where it may actually impact the clinical management, where they may need to get access to those compassionate care medications, and where it may actually impact how and where we care for them in our hospitals.
Do you have any COVID-19 cases of people in nursing homes or senior centers in the district? Any positives in those?
It is a data element that we are keeping very close eye on, and we're working with our partners at that time. We are still prioritizing that group for contact tracing, and we have not identified those risks at this time.
Mayor, one of the questions that's come up, for example, was whether these businesses that are not considered essential could do curbside. Is that anything into consideration? Specifically, I think we're looking at music stores.
We want people to stay at home except for essential business. We've outlined what those essential businesses are, and so we are only allowing curbside for essential businesses that provide food.
And there have been questions about unemployment, being able to get into the system, issues. The other day, I think you said that you should use Internet Explorer if you were going up. and I understand the number of cases that's really soared. Can you give us some kind of assessment of the situation at employment services these days?
Well, we have some very dedicated personnel who are working feverishly to not only take calls, but to evaluate the claims once they've come in. They're deluged, as you might expect, with people who are unexpectedly out of work and looking to make an unemployment claim. We've added some capacity. We were able to get a call center, out-of-town call center that is going to give us additional call capacity. So we expect as more people have already entered the system and we have more call capacity, that wait times for calling the